I keep emphasizing on my show about the need to lead a healthy lifestyle. We can get predisposed to lifestyle diseases such as diabetes if we do not live and eat healthy. As per World Health Organization, there is an emerging global epidemic of diabetes that can be traced back to rapid increase in weight, obesity, and physical inactivity. I caught up with Dr. Prakash Pania from Aster Clinic and Hospital and discussed how it can be avoided. Thank you for coming, and it's so important that we're discussing today. We're discussing about diabetes.
Indeed, diabetes mellitus, a hot burning topic.
Absolutely hot burning topic. We'll start with a very basic question. What is diabetes all about?
Diabetes is a medical disorder in which the blood sugars in the body, more so in the blood, increase. The reason for that is because the pancreas in the body either cannot produce enough insulin to get the sugars in the normal control, or whatever insulin the body is producing is not able to act properly because of the resistance offered by the body to the action of insulin. Now I need to differentiate. The commonest type of diabetes that we have is type 2 diabetes that we see in the middle-aged and the elderly people.
Okay.
But the juvenile diabetes, as you said, is type 1 diabetes. That's a different type of diabetes.
Okay.
That's got nothing to do with the hereditary factor.
Okay.
It's an autoimmune problem where the pancreas is not producing any insulin at all. So there is a relative insulin deficiency in the type 2 or the adult diabetes. In type 1 or the juvenile diabetes, there is absolute insulin deficiency.
So that's why they have to take the
That's
injection.
why they have to take the insulin shots. Of course, there are other things. We have gestational diabetes, which comes up for the first time in pregnancy. We've seen pregnant ladies coming, hormonal causes, other reasons are there. But the commonest is type 1, the commonest is type 2, which is about 85 to 90%. And the remaining is type 1, which is about 10%. And the remaining 5% may be the rest of them.
What are the symptoms? How do we know that we have diabetes?
Well, the first and foremost thing that we need to understand is diabetes is a silent killer. The most common symptoms that we associate diabetes with, excessive thirst, excessive urination, excessive hunger, weight loss, unexplained weight loss despite increased hunger, general feeling of tiredness and weakness. Now, these are symptoms which people associate diabetes with, and it doesn't usually happen. So many a times when the patient gets diagnosed with diabetes, and I tell him that he's got diabetes, and he tells me, "Doctor, I have got none of the symptoms that you associate with diabetes.
Right.
I don't get up in the night to pass urine so frequently. My wounds are healing properly. So how can I have diabetes?" That's when you tell them, you don't have to have all of this. You may have diabetes irrespective of that. If the sugars remain uncontrolled for a long period of time, then it can start affecting its target organs, namely the nerves. They may have eye problem. It is the second most commonest cause of blindness after cataract. It can also lead to kidney involvement, kidney failure. The commonest cause of kidney failure is diabetes. Heart attacks. There is a 2 to 4-fold increased risk of heart attacks in diabetic as compared to a non-diabetic. It also leads to amputation. You've seen a lot of patients, they don't feel things, they get injured, they get burned, they neglect it, and it leads to amputation. Toes, foot, legs, you don't want to wait for all of that.
All of that. So there are so many complications.
These are preventable. These are preventable. So you manage your diabetes well, and you can be away from these complications, or we can delay them as far as possible. And that's why you need to manage your diabetes well.
How do we manage it?
So you manage diabetes by doing your deeds well.
Okay.
The first D stands for diet.
Okay.
The E stands for education. E stands for exercise. And the last D stands for drugs.
Okay.
So if you do your deed properly, you can manage diabetes well.
Amazing.
The first one is diet. As you know, the cornerstone of the treatment of diabetes is management of the diet. So you need to know what are the things you need to take and the things you need to avoid. So that's as far as the diet is concerned. As far as the education is concerned, if you know diabetes, if you're aware of diabetes, then you can treat it well. So it is your job to know what diabetes can do to you and what you can do to control diabetes.
Absolutely, so knowledge always helps.
And through your medium, we are trying to educate your viewers as to what diabetes is and how you can manage it. The next one comes as exercise. Well, you can burn off your calories by exercising. And if we've seen that patients who are exercising on a regular basis, and when I say exercise, I'm talking of not too much.
Yeah,
at
even
least
just
30
walk
minutes,
or,
30 minutes of brisk walking, 5 days a week is good enough. Last comes to drugs. That's what the doctors do first. They put drugs first. Well, if it is required, from day one, drugs may be started. So it depends upon how good or bad the patient's sugars are. Here there's a term known as HbA1c, which tells you the average controlled sugars over the last 3 months.
Okay.
So the patient may be a good patient and come in front of you and say, doctor, my sugars are well. But if the HbA1c is high, it tells you the sugars have been bad in the last 3 months. So you need to keep that HbA1c under the target of less than 7. You can do that with diet, exercise, education, but if not enough, drugs may be required. Okay. So the doctor, depending upon your scenario, depending upon what the complications are, he can choose the drugs that will be the best for you and treat the patient accordingly.
Why is it on a rise right now?
See, the thing is that the stress levels in the world have has increased tremendously. Targets, everybody works on a target basis. People are driven to do the work of 2 people and 3 people.
Yes.
They don't get time. They want to exercise, but they can't. Stress itself increases diabetes.
Absolutely. Stress increases everything.
So that's there. On top of that, increased working hours. On top of that, bad diet. If I'm going to work at odd hours, I'm going to pick up a sandwich or a burger, which is not the right thing for me to have. Where is the time to exercise? So there, I'm going to be putting on weight. And when I put on weight, I'm inviting diabetes come, and plus I have the genes.
Exactly.
So that's the reason why it's very high. And let me tell you, the global prevalence of diabetes is 8.8%, but in UAE, it is 19 almost 20%. So 1 in 5% in UAE is diabetic. In the elderly patient, it is 25%.
Absolutely, and I'm so glad that I'm doing this segment. There's just so much that I'm learning. And the fact that I'm being a medium to take this message to my viewers, it really makes me feel privileged. So Dr. Prakash, thank you so much for coming on the show.
Thank you,
and any questions, if I get, I will pass it on to you.
My pleasure,
I hope you have the time to answer.
The pleasure and honor was indeed mine, ma'am. Thank you for having me on the show.
Thank you so much.
Thank you, ma'am.